Welcome to Navigating a Crisis by Asking for Help. My name is Ted Corcoran. I'm from the Greater Fort Walton Beach Chamber of Commerce, and I'll be moderating this video series as sponsored by the Air Force Association. I'm honored for this segment to have our good friend Master Sergeant Michael Marcum here. Master Sergeant, great to have you here, but it's been a tough time this past year for you, no doubt.
Oh, absolutely. Things have been really busy on the base, especially in the Hurlburt Field Mental Health Clinic.
Now we're titling this one here, Hurlburt Field Mental Health Services. You were right there. How long have you been at Hurlburt?
I've been here about 6.5 years working in the clinic.
All right, so you are boots on the ground, as they would say, right in the middle of the entire COVID-19 and the mental health and all the services. So let's start off with the current trends of COVID-19 with your active duty population. What are you seeing? What's it been like?
So the active duty population has been, much like the community. Initially a lot of teleworking and, what goes into that. People at home for so long, the anxiety, depression, all that stuff starts to set in. You got to configure why is this happening? Why are people usually don't want to work, but
right.
Now they're at home, so they're not getting that camaraderie at work, not getting sit around, have fun, talk with the coworkers, and so they're isolating, which leads to many of our other things. After the anxiety and depression, what happens? Now you have to go back to work, and so things have been on the rise as far as our acuity in mental health along in the community. Suicide rates are up, across the community. That's no different in our active duty population as well. Hurlburt Field has been on a rise this year, a lot higher than it has been in several years as far as the number of suicides. So
yeah, we've read in the paper here locally and had an opportunity to hear, Okaloosa, Walton County, all of Northwest Florida absolutely loves our military. Certainly we love our Air Force and our Army and so on and so forth. But here locally, we hear about the suicide rates. And you were right there in the middle of it, this anxiety, the depression. It's just, what can we do? What can the community do to attempt to help with that?
It's same thing, just, getting those people out, talking to them, seeing them in the community, recognizing them, saying hello, anything like that. Just encourage them to get help. Everybody has a neighbor. We don't all live on base, and, most of us live in the community. So you see your neighbor out there, talk to them, check on them, just a simple hello. How you doing? How was your week? Do you need anything from me? That kind of stuff, it goes a long way.
And we need to make sure, certainly here again, folks in the community, we love the military, so every time you see someone in uniform, say that anyway, but now even maybe more important for us to recognize how much we care for the military here in Northwest Florida. What are some of the symptoms of that young airman or airwoman in referencing the depression, anxiety? Is there anything you can think of, Master Sergeant?
Like I said, one of the things is, these guys are isolating, so if they're going to work, they're coming home and kind of staying put, playing video games and
right.
That kind of thing. So you might not see them that often. So changing up your routine or keeping an eye out, keeping the window open so you can see them, to better go walk outside and say, hey, how you doing? I haven't seen you in a while. What have you been up to?
Got it.
Just trying to find them, meet them on their level, and figure out what's going on in their life. And
the tough part about your job, and I see why you have such short, soon-to-be gray hair, because of the pressure of what you're doing. You have suicides are up, no doubt substance abuse and all that must be up also.
Right, absolutely. This year alone, our substance abuse evaluations and referrals have been up 17% compared to the last few years. And so I know we know that's only the ones that are coming forward or are getting in trouble, and we're finding out about. We know our rates and drinking is high in the military in general. And it's even higher now with all the teleworking earlier this year. People just know where to go, so sit home, have a few drinks, and telework.
Yeah, let's talk about the services that you offer here. We have mental health services there at Hurlburt in referencing. We have families, we have individuals, we must have retired folks. So start off with whatever category you'd like to look at as some of the services that are offered.
So let's look at family advocacy. That's our program. We deal with a lot of prevention, and then also we deal with maltreatment. Those referrals this year have been up 37%. So we try to look at, why is this happening? Well, spouses in our home, children were home a lot earlier this year because of school. So just more people at home, more time for things to happen versus getting that break by going to work and the kids going to school and that kind of thing. So with that program, most of our active duty and their dependents, We were in a new parent support program out of there, which is booming right now due to COVID babies, because we've been about 9 months. So,
I didn't know that. Is there a lot of COVID babies?
So yes, the new parent support program is booming because of that.
We don't. I was not aware of that. That is at least a mild smile in your day to
absolutely.
see that. Now you chat about the dependents when folks are deployed, et cetera. It's got to be really hard for a dependent anyway. But even now, what must be like for a spouse if someone is deployed?
Yeah, TRICARE's made it very simple for dependents, retirees, as long as you're a TRICARE beneficiary of some sort and you want mental health services, and we cannot see you on base just because we're only seeing active duty here in Eglin because we're just so busy. You do not need a referral. You just need to find a provider in the community that covers TRICARE, no cost, nothing. You just go there and see that. The only time you would need something is if you were going for a substance abuse rehab or some kind of long-term inpatient stay, then you would need a referral and kind of pre-coordinate that kind of stuff.
I'm glad that the government takes care of our military through TRICARE. It seems like it has all sorts of different divisions and really a pretty good benefit from an insurance standpoint.
Absolutely. Yep. And then, the vet center, all those places that you had earlier, all those places are here to support the retirees, dependents, and active duty.
Now, are the retirees, are you seeing as many retirees who are in the same anxiety, depression mode as the active duty?
We don't see any on base in our clinic. We can only see active duty right now.
All right, so we do know the vet center. We're talking to Tommy Tucker, and we have Career Source for those looking for a job, and so on and so forth. So there are those services available. But so again, someone's watching this right now, Master Sergeant Marcum, and what are you going to say to that person to say, hey, we're here to help, let us into your world, airman, or, young 22, 23, 24-year-old individual? How would you address that person?
SOCOM, Special Operations has made it so easy here at AFSOC especially, and Eglin is on board as well, with so many opportunities to get help starting at the lowest level. Most of our units on Hurlburt Field have embedded providers and embedded technicians now, mental health assets, so they don't even have to leave their work center. If they're afraid that coming to a mental health clinic is going to keep them from deploying or somebody's going to see them, they're worried, they have embedded providers that sit in their unit. They can just walk down there, say hi to them, meet them, and don't have to step into our clinic unless that provider feels it's something that needs to be elevated to the clinic level. So we were putting people in the units where these guys work so they can trust them and know that they're there, and so they don't even have to leave work if they're uncomfortable doing that.
There we go, and that's a wonderful benefit. Certainly, it's a stressful job anyway, and so it's imperative as folks are navigating a crisis that they ask for help. In this case, Master Sergeant Marcum, one last time, let's talk about some tips for you, for that active duty representative, why they should contact you and when.
So, anxiety and depression, stress, it all goes together. Everybody has it. Sometimes it's good for you to have a little stress, keeps you going. But when that stress or anxiety starts impacting your daily life and you no longer want to get up and go to work, or you can't do your normal job because you're just thinking about things too much, that's when it's time to reach out. Whether it's to a trained peer at that low level, just friend to friend, or one of your embedded providers, or obviously if thoughts are even worse, call our clinic, walk into our clinic, Hurlburt Field, Eglin, call Military One Source. Tons of people just willing to take your phone call and talk to you to get you right back on track.
Another example, folks, here in our community, how we have folks helping out, in this case, Master Sergeant Michael Marcum here from Hurlburt Field, the Mental Health Services Department. Through this series, we're going to chat with the Vet Center, we're going to talk Career Source, we're going to talk about Dr. Copeland with some counseling services, and more. So if you are navigating a crisis, there is help in our community, and you want to contact, in this case, you have that number there for the Hurlburt Field health folks. But there is help in those communities, so please search for it. Search for it. We're here to help in any way we can. Now, I want to thank the Air Force Association for having the initiative of sponsoring this video segment, and I want to thank the Fort Walton Beach Chamber of Commerce, at which I'm employed. We're very grateful to sponsor this, as well as the Holiday Inn in Niceville with Colleen Smith. So stay tuned for more, but please look out for navigating a crisis. There are people here to help you.